2002. Thank you so much, sir, for sparing the time and being here. Your presence here has actually more. Thank you so much. Talking a little bit about ISRRT, which is the International Society for the Radiographers and Radiation Technologists. Now, I got to know that this society came up in 1962 and has got more than 90 member societies, which represents almost about 86 countries, and it has got something like 5,000 society members, and it's got 18,000 associate members. So such a fabulous organization exists. And we're proud to have the president of this organization, Mr. Dr. Napapong, who assumed the charge of the president in 2022, and he is working in Thailand. He traveled all that way to be here. Thank you so much for being a part of this gathering, and your presence has actually added a lot of laurels to this, the conference that we are going to conduct for today and which we did yesterday. The Indian Society of the Radiation Technologists came up, I think, in 1997, and it's again it's got a global presentation now, and we are proud to have the president of the ISRT, Mr. Selva Kumar, with us, who you would be really wondering that he has been holding the post of the president for the past 10 years. So thank you for being with us here today. We have another dynamic person of the society, Indian society, that is Mr. Suresh, and his dynamism came into my knowledge when I first met him for the first time when he came here and requested me to host this conference at AIIMS Bhopal. And it was the way he presented the association and his interest in the academics and research that it took me and subsequently my director to say yes, and we were through and we land up here today having the national conference at AIIMS Bhopal. Thank you, Suresh, for being here. I would also extend a welcome to the other dignitaries who have traveled. We have Dimitris, who is the CEO of the ISRRT. I think he's not here right now. And we have more delegates coming from international countries, from various countries out here, who have participated in the deliberations yesterday and who would still be giving their lectures today. We have been privileged to witness enlightening talks yesterday and look forward to hearing more and more in today's session. Once again, before I finish, I would be falling short of my words if I do not talk about the president of AIIMS Bhopal and the director of AIIMS Bhopal. Since the time Dr. Sunil Malik has taken charge as the president, since the time Professor Ajay Singh has become the director of this institute, he has set the ball rolling in terms of academics and research. He has always promoted such activities in this institution. He doesn't take a moment to decide and say, yes, go ahead with this. And his hand on the shoulder is good enough strength for all of us to take the journey forward. Thank you, sir. Thank you, Dr. Ajay Singh. Thank you, Dr. Sunil Malik, for being with us every time, anytime, anywhere, everywhere. Thank you so much. I would close here, welcoming all the delegates once again repeating that you and me are one. We are together. We will always be together. I cannot move without you. We are the four wheels of a car who move in the same direction together. One going away would disrupt the entire journey. These four wheels will decide the pace, it will decide the safety, it will decide the outcome. So let's hold hands together for future and take this journey to much and more laurels in future. Thank you so much.
Thank you very much, sir, for your welcome address. The vision of ISRT is to keep high standards of patient care, promote excellence in practice by recognizing qualified individuals in medical imaging, nuclear medicine interventional processes, and boosting all persons' professional esteem who are handling these sophisticated technology. I humbly request President ISRT, Mr. A. Selva Kumar, for his address and share more about ISRT. So, please.
Namaste, Swagatam, very good morning. Respected Chief Guest, Dr. Ash Magajan ji, and our International ISRRT President, Dr. Napopa, and other learned, distinguished members on the dais, off the dais, my fellow ISRT family members, and our radiology fraternity members. Warm welcome you all to this city of Lake Bhopal. It's my proud pleasure moment that today we are sitting on the dais with Dr. Magajan, so one of our pioneers in this field of radiology. And last year, sir is in our Delhi Apollo Hospital when we conducted our state level conference. He see that what are our scientific feast and how we are doing that. He blessed on the day to our family members. Sir, thanks for your words and your support, sir, for our entire family ISRT members. Thank you. And ISRT always awarded as an umbrella forum for all the radiation workers working in India on Indian origin working out globally. So we started in a small region and slowly developed. Now our wings are spread throughout India from Kashmir to Kanyakumari and Gujarat to West Bengal and to the Himalayan region also. And our roots are our members. With the support of members, we are growing not only laterally and vertically also. Few years back, we joined with the International Forum ISRRT, and few of our members are associated in a good positions in an international area also. Our achievements are very small only when you are going into the international region. During the COVID, the entire world know about the power of the radiographers. The main force during that COVID period, without the radiographers, is diagnosing and treating that patients is very, very difficult one. But our entire members came in front and fight with the nation to make it eradicate from internationally. And few of our members succumbed to this disease also, but other members stayed courage and did their job very well. And we have few subsidiaries. One of the subsidiaries is Alara magazine. We recently, in 2022, we celebrated 25 years of Alara. It's a monthly magazine for the benefit of all the radiographers. We are publishing most of the articles from, and our students, members also participate in these activities. And one more subsidiary, Garcio, Global Association for Radiographers of Indian origin globally. And in 2022, our website is launched by our International President, Dr. Napopang ji in Thailand. And we conducted few seminars and online meetings through this Garcio for the global friends. And successful people are not gifted, they just work hard and succeed on purpose. There is no secret to success, it is a result of preparation, hard work and learning from the failures. We have learned from our failures and slowly we grown to this level. As Tiruvalluvar, the poet from Tamil Nadu. It means when we are learning, learn entirely, thoroughly, and work on the basis of that entire learning. And one more thing, கற்றது கையளவு கல்லாதது கடலளவு. It means what we learned is one handful only, but still we have a lot of things to learn, like an ocean. The learning is an ocean, and we are on the process of making this learning continuously through our academic clubs. And every year we are conducting like these national forums to make the recent advancement to go to the entire members of our community. And yesterday we had a lot of interaction on all the new modalities, AI and National Commission of Allied Health Forces, how it will improve, all the things we discussed yesterday also. And in this juncture, I am proud to announce that during 2015, in our Chandigarh meeting, then Union Minister of Health, Dr. Nadda, has announced that we'll get this National Commission for Allied and Health Forces. So soon it make a reality, and he announced that model curriculum for our Allied Health Forces, and a few of our society members or the members of the curriculum board, and most of the suggestions given by our organization are adopted in this curriculum and the Allied Commission also. Now we are proud that this year the National Commission for Allied and Health is coming to the force, and chairman is appointed already, and hope soon we'll get the regulation for our profession, because without any proper regulation, it's very difficult for us to grow in volumes. A standard education is required. In that field, we are moving ahead, and with all the supports, all the dignitaries here, hope we'll do the very good for that. It means
Thank you very much, sir. The four pillars of practice radiology are clinical practice, leadership management, education, and research. Now, I request General Secretary ISRT to present annual report about their accomplishments and achievements of the year. Thank you, sir.
Respected chief guest of the event, guest of honor of this event, Dr. Harsh Mahanji, Padma Dr. Harsh Mahanji, respected President of ISRRB, Dr. Napapam, Dr. Sunil Manikji, Dr. Ajay Singhji, other things on the dais, my dear colleagues, friends, and favorite students. It is with a deeper sense of joy, hope, and gratitude that I am addressing you all. Truly, this is an auspicious occasion for us. It is not only by the overwhelming response you have shown, but also by the gracious and august presence of our guest of honor and our other dignitaries. I thank all of you for making this wonderful event, especially the organizing team and our members. Before coming to the organization report, I wish to, with the permission of the chair, I wish to take a couple of minutes to brief the Indian scenario of radiology technology. We all are so blessed to work in radiology, which is considered as one of the most advanced and innovative branch in medicine. I dare to say, there is no other branch in modern medicine which has undergone through a tremendous and rapid changes like radiology. We thank the man, the godfather or founder father of this branch, William Conrad Röntgen. At the time of his invention, that X-ray, invention or discovery for X-ray was the incidental intelligence of the scientists. But radiology, right now, it is entered into an era of artificial intelligence. So, from an incidental intelligence of a scientist to the artificial intelligence, the voyage of radiology is something beyond the word incredible. We are so blessed and we are so happy to work in this sector. Truly, the voyage of radiology or the achievements of radiology is only because of technological innovation, and without the technological innovation, radiology becomes zero. While there is an increased dependence on technology, there will be an increased dependence on technologies. Technologies are considered as the heart of a radiology department or backbone of a radiology department who are really connecting the technological innovation with clinical medicine in a fruitful manner. But in India, our role is not geared up to the standards due to a variety of reasons. One of the reasons is the lack of a regulatory mechanism. But as Mr. Selvakumar told, it was declared by the Dr. Nadaji, Deputy Nadaji in 2015 in Dice of NCISRT only about the National Commission. At that time, it was a National Council, and it is geared up to the National Commission, as per in the line of NMC. So I am very happy to inform the meeting, all of you, that Dr. Dr. Yekna Unmesh Shukla has been appointed as the first chairperson of the National Commission for Allied Health Professions. It was recommended by the Committee of Appointments, Cabinet Committee of Appointments. I congratulate her and I congratulate the government for appointing a very good, dynamic and a very visionary leader of the first chairperson of the NCAHP. So I would like to enter the points we have attained within 2 minutes. The organization year 2020-23 was started with the World Radiography Day or International Day of Radiology celebrations in the Apollo hospitals last year and nearing to end today. In the past 1 year, we have attained 4 or 5 major milestones in this voyage. We entered into the global platform in 2018, but in 2022, we have been elected, honored as the permanent member in the ISRRB. Personally, for me, I was so blessed and lucky enough for being elected as the Asia Australasia Regional Coordinator for Professional Practice. Our entry in the global platform is a mass entry. 36 members attended in Bangkok conference. It was the biggest number in the history from India. And it was the second largest delegation in the global area. First was Indonesia. And we have already also attended in Kochi for Asia Australia Regional Conference. At the same time, we have presented our bid to host AACRT, Asia Australasia Regional Conference for 2025. But unfortunately, fortunately or unfortunately, we lost it. But we took it as with the sportsman spirit because our Napopansar's parent country, Thailand, has won. I congratulate them, Thai society. But sir, we will look for 2027, no doubt. In 2022-23, as Selvakumar told, ISRT has played a pivotal role in shaping the curriculum, model curriculum. I would like to mention one name, Mr. Shashi Shetty. He was the lead role. He is our member for Southwest India. Also, ISRT has played a pivotal role or instrumental in making the state allied health councils in many states. Mr. Vinod Chauhan, a person from our community, has been elected as the first secretary of Himachal Pradesh Council. I congratulate Mr. Chauhan. At the same time, we have conducted a lot of programs, World Radiography Day events, regional CMEs, and started the workshop-like programs by ICRT, Indian College of Radiology Technology. One more milestone even we have attained, and we have signed an MOU with AIIMS, Andhra Medical Technology Zone. And I'm so happy to announce that AIIMS Vizag is one of the largest medical technology zone in Asia, is going to host our next national conference in September, NCAZ 2024 in September. Moreover, we have signed 5 years MOU with AIIMS, Annual Radiology Meet in Dubai, conducted by RAS and RACE, Radiology Society of Emirates and Radiographers Society of Emirates. Mr. Hashim Al-Awali, he is with us today also. He is instrumental for that event. By this, I wish to conclude my report. Thank you all.
Thank you very much for sharing such a remarkable journey of ISRT. The skill and roles of radiographer as we know it, X-ray and other imaging modalities, but they are also trained in excellent interpersonal communication, good observation, analytical and attention skills, decision-making skills, and ability to remain calm under the pressure. And that makes them very extra in their work. Now I kindly request Dr. Napapong Sir, President, International Society of Radiographers and Radiological Technologies, for his address. Sir, please.
Namaste and very good morning. Dr. Rajesh Malik, organizing chairperson for this Congress, and our guest of honors today, Dr. Padma Shri and Dr. Harsh Mahajan, and especially the president of ISRT, Mr. Salva Kumar here. On behalf of the board management of the ISRT, the International Society of Radiographers and Radiological Technologists, I would like to congratulate the ISRT for your successful in hosting this Congress here in Bhopal. We have long history together. Back in 2011, I was in Kanyakumari to meet you, and from that time, we have been working together throughout the year, and I am very, very happy to see the progress of the ISRT here in India for your great success and growing to represent the radiographers and technologists throughout the country. And this year especially, the ISRT, for your progress, and you have contributed to the international arena, especially early this year in Vienna, we have attended the European Congress of Radiology. We had a very successful session of ISRT Meets India, and you sent speaker to this Congress, and the world has witnessed the progress of your professional practice here in India by your delegates that presented in that Congress in Vienna. And I do hope for more collaboration between ISRT and ISRT to reach out to promote the quality and safety and standard practice of radiographers and technologists worldwide. And again, I would like to thank to all Indian radiographers and technologists here. Your hospitality touched my heart. Throughout the year that I have been here in India, this is my third trip, and I hope for more trips to India to collaborate with you for the progress of our profession. Thank you so much.
Thank you, sir. A true leader is the one who knows the way, goes the way, and shows the way. This quote starts.
बहुत बहुत धन्यवाद। सबसे पहले तो मैं आप सभी लोगों का जो भी मंच पे मंचासीन है और जो भी गेस्ट हमारे सामने बैठे हैं, आप सब लोगों का एम्स भोपाल में मैं बहुत बहुत स्वागत करता हूं। एम्स भोपाल एक ट्रेडिशन है कि जिसमें हम लोग हर उस एक्टिविटी को प्रमोट करते हैं जो कि साइंटिफिक हो, जिसमें हमको फ्यूचर प्रॉस्पेक्ट दिखाई पड़ते हैं। और जब डॉक्टर प्रोफेसर राजेश पलिक शायद 2-3 महीने पहले जब हम लोग मिले और हम लोगों ने इस प्रपोजल को विचार किया, तो मुझे लगा कि ये एक अच्छी अपॉर्चुनिटी होगी, ना सिर्फ एम्स भोपाल के लिए बल्कि अच्छी अपॉर्चुनिटी होगी एम्स भोपाल को शोकेस करने के लिए, क्योंकि एम्स भोपाल को शोकेस करना भी मेरी एक जिम्मेदारी है और मैं उस जिम्मेदारी के तहत यहाँ पे खड़ा हूँ। तो मुझे खुशी है कि आज इतने इस अवसर पे इतने सारे डेलीगेट्स, रेडियोग्राफर्स और टेक्नोलॉजिस्ट हमारे सामने हैं, क्योंकि मुझे याद आता है कि मैं डॉक्टर राजेश पलिक साहब से कह रहा था कि हम लोगों को 24/7 सर्विसेज बढ़ाने के लिए अच्छे टेक्नीशियंस और रेडियोग्राफर्स की ज़रूरत है, और डॉक्टर साहब ढूंढ नहीं पा रहे थे। तो इतने सारे लोग यहाँ पे खड़े हैं, तो मैं एक बार अपील करता हूँ, आपके पास बहुत अच्छी अपॉर्चुनिटी है एम्स भोपाल में, आपका फ्यूचर बहुत ब्राइट होगा। तो जो लोग भी इसमें इंटरेस्टेड हों, प्लीज़ हम लोगों को कुछ मौका दें। जैसे मुझे बताया गया कि मैं एक आर्थोपेडिक सर्जन हूँ और उसमें भी पीडियाट्रिक आर्थोपेडिक सर्जन हूँ। तो रेडियोलॉजी तो एनेस्थीसिया और रेडियोलॉजी, कोई भी सर्जन स्पेशली आर्थोपेडिक सर्जन जो है वो इन दो विधाओं से अलग नहीं रह सकता। और कुछ लोग KGMU के पुराने लोग यहाँ पे बैठे हुए हैं, जो जब मैं रेजिडेंट था और ये लोग वहाँ पे थे, तो कैसे हम लोग दौड़ दौड़ के अपना एक्सरे करवाने के लिए भागा करते थे। तब से और आज तक हर फील्ड, हर प्रकार से जो है वो नए इनोवेशंस हुए, जो टेक्नोलॉजी है वो बहुत ज़्यादा प्रोग्रेस कर गई। सारा हमारा कंसंट्रेशन कि कैसे हम अपनी इमेजिंग की क्वालिटी को इम्प्रूव करें, कैसे डायग्नोस्टिक फीचर्स जो हमारे हैं वो हम उसको और बेहतर तरीके से, जिससे कि पेशेंट्स की डायग्नोसिस बनाने में रेडियोलॉजी की जो भूमिका है वो कम नहीं होनी चाहिए, बल्कि हम लोगों को, आप लोगों को एक कॉम्प्लीमेंट की तरीके से, एक इक्वल पार्टनर के रूप में क्लिनिकल मैनेजमेंट के आप लोग हैं। मैं ये पूरी मुझे खुशी है कि जो प्रोग्रेस आप लोगों के इस विधा में, जैसा कि बताया भी गया कि लगातार वन ऑफ द मोस्ट हैपनिंग स्पेशलिटी इज दिस स्पेशलिटी। और मेरा ये मानना है कि कोई भी क्लिनिकल जो स्पेशलिटी है उसमें जो भी प्रोग्रेस हो रही है, जो भी इनोवेशन हो रहे हैं, उसमें रेडियोलॉजी का अपना आप एक बहुत बड़ा इम्पॉर्टेंट रोल है, क्योंकि आज के ज़माने में हम लोगों को डायग्नोसिस बनाने के लिए हम लोग बहुत ज़्यादा डिपेंडेंट हैं। लेकिन मैं आज जो नई पीढ़ी है, मैं आज इस मंच से उनके लिए ये भी मैं बोलना चाहता हूँ कि जब हम लोगों की ट्रेनिंग हुई थी तो हमारे क्लिनिकल साइंस हम लोगों को पढ़ाए जाते थे, और वो क्लिनिकल साइंस के माध्यम से हम लोग डायग्नोसिस बनाते थे। उस डायग्नोसिस को कंफर्म करने के लिए हम लोग रेडियोलॉजी पे जाते थे, ना कि डायग्नोसिस बनाने के लिए रेडियोलॉजी की सपोर्ट लेना चाहिए। थोड़ा सा यहाँ पे शिफ्टिंग हुई है और मुझे लगता है वो अच्छी शिफ्टिंग नहीं है। तो हमें आज भी अपने आप को क्लिनिकल स्किल जो जिसके लिए भारतवर्ष माना जाता है वो उस पर हमको रहना चाहिए और लगे रहना चाहिए। रेडिएशन जो है वो यदि क्वालिटी इम्प्रूव कर रही है और हम लोग नई नई टेक्नोलॉजीज को हम अपना रहे हैं, लेकिन हमको सबसे ज़रूरी इस बात पे ध्यान देना है कि हम लोगों को रेडिएशन को भी साथ में कम करना है, क्योंकि आज ये छुपा हुआ कोई ऐसा छुपा हुआ फैक्ट नहीं है जिसमें हम लोगों को साइड इफ़ेक्ट्स ऑफ द रेडिएशन पे हमें नॉलेज ना हो, या हम जो अभिन्न हैं जो हमको पता ना हो, ऐसी बात नहीं है। तो मुझे पूरा विश्वास है कि आप लोग जो भी आज जो भी साइंटिफिक डिस्कशन में आप लोग इस बात का भी ध्यान रखेंगे कि कैसे क्वालिटी इम्प्रूव हो, लेकिन जो रेडिएशन है, रेडिएशन से पेशेंट्स और पेशेंट्स के साथ वाले और इवन आप लोग खुद उनके साइड इफेक्ट से बचे रहें, तो ये एक मेन एक डिस्कशन का एक मुद्दा होना चाहिए, ऐसा मेरा मानना है। रिसर्च और इनोवेशंस एक इंटीग्रल पार्ट है। माननीय प्रधानमंत्री जी ने जो मेक इन इंडिया का नारा दिया है, और उसमें मुझे ये कहते हुए खुशी है कि रेडियोग्राफर्स और रेडियोलॉजिकल टेक्नीशियंस जो हैं वो एक बहुत ही इम्पोर्टेंट रोल प्ले कर सकते हैं, क्योंकि हम लोगों का एक ऐसी टेंडेंसी हमने देखा कि हम लोग जो भविष्य जो पश्चिमी देशों से जो हम लोगों को टेक्नोलॉजी आ रही हैं वो हम लोग अभी तक अपनाते थे, लेकिन अभी पिछले कुछ रिसेंट पास में हमने देखा कि इंडिया जो है वो अपनी एक पोजीशन जो कि उसने अभी तक नहीं प्राप्त की थी वो पहुंच रहे हैं। तो मैं बहुत ही इस बात के मुझे उम्मीद है, पक्का विश्वास है कि इनोवेशन के माध्यम से मेक इन इंडिया का जो सपना हमारे प्रधानमंत्री जी का है वो उस पर आप सब लोग विचार करेंगे और उस पर इम्प्लीमेंटेशन करेंगे। मुझे खुशी है ये बताते हुए कि एम्स भोपाल में हम लोग बायो इंक्यूबेशन एंड इनोवेशन सेंटर का बहुत जल्द इनोवेशन करने जा रहे हैं, और ये शायद एम्स न्यू एम्स में पहला एम होगा जिसमें इस प्रकार का इंक्यूबेशन सेंटर बनेगा। उसमें भी मैं आप सब लोगों की, आपकी इस एसोसिएशन के लोगों का मैं अपील करता हूं कि आप लोग आएं और हमारे इस इंक्यूबेशन सेंटर के साथ आप बंधें और कुछ हम लोग नया कर सकें एम्स भोपाल में रहते हुए, तो शायद हम जो सोसाइटी में कंट्रीब्यूशन करना चाहते हैं वो हमारा सफल होगा। और लास्ट में मैं ये कहना चाहूँगा कि भोपाल एक बहुत ही सुंदर सिटी है। मुझे नहीं मालूम है कि ऑर्गेनाइजर्स ने कितना समय आप लोगों के लिए सोशल एक्टिविटीज़ के लिए या भोपाल में घूमने के लिए रखा है, लेकिन मुझे पूरी उम्मीद है कि आप लोगों को यहाँ पे मौका मिलेगा भोपाल देखने का। भोपाल में आधुनिक चीज़ें भी हैं, पुरानी चीज़ें भी हैं, आपको हिस्ट्रीज भी आपको मिलेगी। तो आप सबसे मेरी अपील है कि आप एम्स भोपाल में भी घूमें और एम्स भोपाल के बाहर पूरे भोपाल को भी भ्रमण करें। ऐसी उम्मीद के साथ मैं एक बार फिर आप सब लोगों का बहुत बहुत धन्यवाद देता हूं कि आप लोग यहाँ पे सब आए और आपने मुझे बुला के अपने विचार व्यक्त करने का मौका दिया। धन्यवाद।
Thank you, sir. It's an honor to invite Dr. Sunil Malik, sir, our President of AIIMS Bhopal, the Chief Patron of the event. Sir is a renowned, accomplished, and a well-revered neurologist of Central India. His immense contributions to the progress of our institute have been valuable. Sir, please share your valuable and profound wisdom with the gathering.
Director AIIMS, Professor Ajay Singh, President, International Society of Radiographers and Radiological Technologists, Mr. Napapong, Panganapong, President, Indian Society of Radiographers and Technologists, Mr. A. Selvakumar, General Secretary, ISRT, Mr. Suresh Malik, Organizing Chairperson, Professor Rajesh Malik, Organizing Secretary, Shri Seravan. A very special and warm welcome to our guest of honor, Dr. Harsh Mahajan. Both Dr. Harsh Mahajan and Dr. Rajesh Malik, they've been my teachers, so this event is very special for me. Distinguished speakers, esteemed delegates, and my dear friends, I extend a very warm welcome to you all to the All India Institute of Medical Sciences located at Bhopal, which is the capital of what is called the heart of India, the state of Madhya Pradesh. Our institute, although it is less than 1.5 decades old, has been making rapid strides on every front under the able leadership of our director, Professor Ajay Singh. I take this opportunity to second his request to all the radiographers present over here to join us. I extend my heartiest congratulations to Professor Rajesh Malik, the organizing chairperson and the organizing secretary of this and the entire team for holding this conference, which I believe is of great significance considering the role of radiographers and radiological technologists. Their role has been paramount in providing quality diagnostic services. The role is going to only increase in the future. I am a neurologist and I realize the importance of this fraternity. The topics chosen for this conference, the speakers invited, they show the level of thought and preparedness which has gone into this conference. I was going through the list of topics. Included are topics which behold the future, like the role of artificial intelligence. Also included are topics which have always been and will always be relevant, like ethics in professional practice, quality control, quality assurance, and professional regulations. In India, the focus on health has been paramount in the last decade or so. Worldwide, the COVID pandemic brought health to the forefront of policy making. Our nation responded to the COVID pandemic with competence, alacrity, and empathy. The role of medical and paramedical personnel in the lives of people all around the world is paramount. Let us all put our hands, hearts, and souls together and strive for the betterment of humanity all around us. Once again, I wish you all the best for this important conference. May God bless you all. Thank you. Jai Hind, Jai Bharat.
Thank you very much, sir, for your kind words. Now, it is my honor to introduce Padma Shri Dr. Harsh Mahajan, an eminent radiologist and a pioneer in the field of MRI in India, having set up India's first MRI in 1991. Sir is a founder and chairperson of Mahajan Imaging and Labs and holding many key positions in the field of imaging, neuroscience, nuclear medicine, NABH, National Human Rights Commission. Sir was awarded Padma Shri of India in 2002, and he is one of the 2 recipients of this award in the field of radiology till date. I invite Sir for his talk.
Thank you very much. Good morning, distinguished dignitaries on the dais, off the dais, students, delegates, ladies and gentlemen. It's a singular honor for me and a pleasure. Rajesh, thank you for inviting me. An honor to be present on this beautiful campus, in this beautiful city, and in front of a galaxy of radiographers, teachers, technologists. I do believe that, and I've held this belief since the beginning, that to be a good radiologist, you have to first be a good radiographer. When I started MRI in 1987, I mean, you can imagine there was very little, and when we started in India, I had to be everything. You know, position the patient, be the radiographer, also write the report at the end of it. And I think just as medicine is an art, radiography is also an art. You can have those using the same machines, producing brilliant diagnostic images, and those who may produce images where the radiologist is struggling to make a diagnosis. So I compliment you, I congratulate you, and as Dr. Rajesh Malik said, we are part of the wheels of a car, and we have to run in tandem. Only then will we be able to make the correct diagnosis. And not only diagnosis, you are also involved in treatment with interventional radiology, which unfortunately still in this country is called a new field of medicine or a new field of radiology. Whereas in 1984, when I started my MD at PGI Chandigarh, that's when interventional radiology started in this country. And so it's been 39 years, and we still tend to call it a new field of interventional radiology. And I was very pleased when I came to know that interventional radiology has taken roots in AIIMS Bhopal and is being practiced on a daily basis. And also fellowship probably is going to start next year. And I've requested Dr. Malik to actually name the Department of Radiodiagnosis as the Department of Diagnostic and Interventional Radiology, which is what it actually is, and it will convey the right meaning. So, the other thing I want to say is that with the international ISRT and some of our own national, society also happens to be ISRT. I think we need to work more closely, work in tandem, because as Director AIIMS Bhopal has just alluded, there is a lack of skilled manpower in this country, especially radiographers. And so if we could work in tandem, work together, I think AIIMS Bhopal is a place where we could produce many technicians and technologists who not only benefit the area locally, but also across the country. And as is born, many of our radiographers actually, by and large, all of them are so good that they are well sought after, even in different parts of the world. And so we could become the breeding ground for these high-end technicians who spread far and wide within the country and abroad. This conference is focusing on all parameters and going even beyond that. You're talking about artificial intelligence, and as has been said, radiology actually has transformed tremendously over the last 3 decades. It is the most sought after branch of medicine. Those who come first in the NEET entrance exam want to take radiology. And also now with artificial intelligence coming in, we have to be careful, we have to be vigilant, we have to also be willing to adapt to it and adopt it at the same time. And I was, I think about 2 weeks ago at AFMC Pune, where they've just started a Department of Computational Medicine, which includes majorly a Department of Artificial Intelligence, and maybe time is right to start something like that. Maybe start on a small scale and then scale it up, because you have all the talent, you have the technology, you have the equipment, you have capable youngsters willing to take this forward, and that would be my suggestion, because they just started this at AFMC Pune. With that, I welcome you all, congratulate you, and wish you all the very best in this learning experience. Thank you very much.
We are incredibly proud of ISRT's accomplishments and achievements. We would like to delightfully show our gratitude to all our dignitaries of NCISRT 2023 for their presence today and their valuable contribution in their respective fields by presenting a token of gratitude. I kindly call and request Dr. Sunil Malik sir, President AIIMS Bhopal, to felicitate our guest of honor, Padma Shri Dr. Harsh Mahajan sir. humbly request our dynamic Executive Director and CEO of AIIMS Bhopal, Professor Dr. Ajay Singh Sir,
who knows the way, goes the way, and shows the way. This quote stands true for our Executive Director.
I request Professor Rajesh Malik Sir to felicitate President AIIMS Bhopal, Dr. Sunil Malik Sir. I kindly request again Professor Rajesh Malik Sir to felicitate our Executive Director and CEO AIIMS Bhopal, Professor Ajay Singh Sir. Now I request Dr. Deepinder Vishwakarma, Finance Secretary, NCISRT, to felicitate Mr. S. Selvakumar, President ISRT. I humbly request Mr. Mahendra Sharma, Organizing Secretary, NCIRST, to give a token of gratitude to our chairperson, Professor Dr. Rajesh Malik Sir. I request Dr. Abhishek Sherawat, Organizing Secretary of NCIRST, to felicitate Mr. Suresh Mailath, General Secretary ISRT. I call upon Mr. Vimal Patidar, Joint Secretary, NCIRST, to present a memento to Dr. Abhishek Sherawat, Organizing Secretary, NCISRT. Thank you, our distinguished guests.
As we draw this remarkable event to the close, it is my privilege to invite Mr. Abhishek Serawat, the Organizing Secretary of the National Conference of ISRT, to express our heartfelt gratitude in the form of vote of thanks.
Namaskar, good morning to everyone. First of all, I would like to thank Dr. Napapong, Dr. Rajesh Malik, our President, our Chief Guest, Dr. Harsh Mahajan, our Director Sir, and Selva Kumar Sir and Suresh Malayaji for organizing this great conference at AIIMS Bhopal. So, also I would like to thank all of you to join us, to give your valuable time in this event, to make it a successful, remarkable journey, to take it to a successful journey. So, first of all, let me start with my introduction. I did my bachelor's from AIIMS Delhi, and at that time, when I was interested in the research area. At that time, Dr. Mahajan Center was there at nearby Hajj Khas, and when I met professors at IIT Delhi, I used to know that Dr. Mahajan has research and development set up in their center. At that time, I was very much interested to meet him, and finally, with the grace of Dr. Rajesh Malik, he invited him. We are thankful to him. And as our director sir told that we should do innovative, we should learn, and you are welcome to join here at AIIMS Bhopal. So in his presence, I got an opportunity to do PhD, part-time PhD over here with his permission. So I'm learning things, and I would like to tell everyone that you should join, even if you're a student or if you're a technologist, you can join here, because our director sir introduced a Center for Interdisciplinary Sciences, where different programs are running, where you can integrate radiology with cancer studies and different biological aspects. So even they have started from last year when he joined, and he committed that he will start PhD for different branches. So last year only, in this 6 months only, he started PhD in radiology and 18 different streams. So you, all of you who are interested, you should show interest, because radiology is a field where learning never stops. So always, I would like to conclude my talk, because I would like to thank everyone for coming here, and these kind of conferences will definitely improve your skills, and for students you will learn so many things, and radiographers will learning never stops in this field. So in medical area, especially in radiology, learning never ends. At the time when there was dark room, now new technologies came, dark room is completely obsoleted. Now artificial intelligence has evolved, so we need to learn step by step. So with this, I would like to conclude my vote of thanks, and I would like to thank all the delegates for coming here, giving wonderful sessions, and being with us. Thank you.
Thank you, Mr. Abhishek. I kindly request all to rise as we honor our nation with the playing of national anthem. Thank you. Now we progress further with the further proceedings.
Good morning, ladies and gentlemen. I would request you all to please proceed for high tea. We will be beginning this session again within 10 minutes. Thank you.
दीप भाई take one photograph with you, sir, if you don't mind, sir. Hello. Event पे event. क्या हुआ? अरे अभी बात नहीं हुआ जी प्लीज आगे बाबू को लिया बाबू मैंने फोन नंबर आज लूँगा हाँ के बाद लूँगा so much.
all radiologists, technologists and radiographers to include their day-to-day practice with AI, and that is very helpful, sir, as sir mentioned that AI, doctors with AI will replace doctor without AI. That is true, and that going to be happen in the future. Thank you very much, sir. Thanks a lot, sir.
Thank you.
Thank you, sir, for this amazing talk. Our next speaker will be enlightening us on patient-centric radiology practice, future of sustainable radiology. I would request Dr. Deepak Patkar, sir, Director of Medical Services, Nanavati Max Super Speciality Hospital, Mumbai, to please come to stage, and I would request the chairpersons to please introduce sir. A huge round of applause for sir, please.
Welcome Dr. Deepak Patkar, sir. He is a Director of Medical Services at Department of Imaging, Nanavati Max Super Specialty Hospital, Mumbai. And he is a past president, IRIA, Indian Radiological Imaging Association. He has nearly 36-year experience in the field of radiology. And he is a leading medical administrative and functions and instrumental in clinical team expansion. Welcome, sir.
Can I have the changes slides? Want me to go back, sir? Not getting connected.
Thank you, and pardon me for the AI glitch. So I take a cue from what Harsh just said. We know we're going to be partially replaced by AI. If we follow patient-centric radiology practice, that's the real future of being sustainable in terms of radiology. And I'm going to talk about that for the next 20-25 minutes. Before I do that, I must acknowledge contribution to this talk from my colleagues in the department, Vidusha and Ritvik. And I must thank all the organizers of NCI SRP for calling me here. When we talk about patient-centric radiology, we know it's a given because when we are getting trained, we're taught about how to talk to patient, how well we should take care of patient, etc. And I'm sure all of us try to take the best care of patients when we interact with them. Like her said, spend 15 seconds with them, spend a minute with them, they become much more cooperative and understanding than what they would otherwise be. The idea of this presentation is we need to revisit it all the time. In our busy schedule, we forget about it. So we must do it every day, every minute, every patient, and do it better than what we are doing. And what it will bring on paper, if we do that scientifically, is we do it very, very well all the time, 365 days, 24/7. We, of course, forget this when we get very busy, because for us, it's a daily routine. For us, it's one of the 1,000 scans that you already performed. But for the patient, it's probably only one in its lifetime, and that we forget all the time. Because we know everything, we expect patient to know everything, but that's not the truth. We presume that they know, but many of them actually do not. They do not know what they're going to undergo. Painful or painless, troublesome or troubleless, claustrophobic or not so claustrophobic. So if we communicate well, we can definitely get better images. You as technicians, you know that how important it is. Hence you become a good technician, but more importantly, a good human being. We are in an industry as a caregiver. I am going to reiterate that over the next 20-25 minutes, what has already been taught by a lot of you and what we already know. Patient centricity, because you are the patient's guardian when the patient comes to you. Typically, the attitude over years becomes paisa le lo, scan karo or bhej do, and then talk to your doctor because he is the one who's sending you the patient. This attitude should not happen ever in your life. So what I'm going to do in the next 20-25 minutes is make you understand the concept of how patient-centric radiology is very, very important in today's world where artificial intelligence is coming in a big way. What is the key to patient experience and care? What are the facets of patient-centric radiology? We just look at talking to patients for a few seconds, but a lot of things which happen before and after, which we are part of, but we forget that we are part of it. We look at what the world is saying and review the literature. How AI is going to completely change radiology, but not only radiology, also the future of patient care in a radiology center or radiology department. And then I have two concluding videos which are very, very important, and that's my actually take home. Patient centricity is not new. We talk about it over the last 2 or 3 decades. But Dr. John Murphy, who's considered to be father of surgery, in 1870 from Chicago, said that the patient is the center of the medical universe around which all our works revolve and towards which all our efforts tend. I would add, efforts should tend and works should resolve. Last 10-15 years or maybe 20 years, consumerism has come in India. Otherwise, doctors were considered as gods and whatever they would say would be acceptable to patients. With consumer law coming in, there is Americanization of medicine. by default, we have become caregiver, and by default, the patient has become consumer. And because of that, a lot of us have to change completely. As I said, when we talk about patient experience, we just looked at patient coming in, getting scanned, collecting the report and going out. We studied this in our hospital at Nanavati, and we realized, this is about the hospital touch points, we realized that there are about 125 touch points that the patient faces, starting from calling on a call line or call center, taking an appointment, making a payment, taking a history, etc. So there are almost 125 touch points that the patient undergoes. So obviously so many people come across the patient, and they have to be all very, very nice. It's not only technicians and it's not only radiologists. The concept of patient experience has been divided into 4 subparts. It refers to many varied interactions that the patient have to undergo in a healthcare system. It starts with insurance companies treating patients badly. Then it goes on to doctors, nurses, staff in the hospital, front desk, physician practices, and several other healthcare facilities. Patient experience is divided into interactions, culture of the place or institute, perception of the patient, the reputation that they take home, and continuum of care. The interactions is based on touch points that I talked about. Touch points with front desk, touch point with processes, touch point with policies of the center of the hospital, communications that all the people across do, actions that the people take, and the working environment that they have. In terms of culture, we know certain centers are very, very patient-centered, certain centers are not. And that is inculcated by the center owner. So he has to have the vision, values, he has to have right people and community in and around his center. Perception is what is understood by the patient. First talked about it. You touch him, say everything is fine, or you have a little bit of problem which your doctor will resolve. That will be remembered by the patient and family members forever. I have 3rd generation of patients coming up now. That's because I have treated their parents and grandparents well. They don't remember the report that I gave them, but they remember how I communicated with them. So continuum of care is part of perception. It also talks about not only the scan that you're doing and the delivery that you're talking about. It also talks about what you did before and what you did after, whether you communicated with the doctor or no, you called up that patient and talked about his health or no. So it's a very complex situation when we talk about patient experience concept. There is a difference between perception and experience. Experience is associated with patient's perception of care, what he is accepting or expecting. While patient satisfaction is all about whether his expectations are met or no, and then whether he'll come back or no. Coming to radiology, how patient-centered radiology has been talked about alongside artificial intelligence over last 15 or 20 years. The vision of patient-centered radiology is considering patient as a primary face and not the referring doctor or marketing efforts. Mission is to encourage and to facilitate radiologists and technologists in meaningful engagement with the patient experience. They have to know what is happening around. It's not only sitting on the console and scanning or sitting on your packs and reporting. You have to get out, check around, help around, etc. and try to improve. The idea is to promote goals which are patient-centric. So it is alignment of radiology practice with patient's need and best interest of the patient, what is right for the patient. To optimal patient experience throughout the continuum of their radiological care, as I said before and after. You also require effective communication with patients and not only the patients, but referring doctors, relatives, etc. to tell them what is being asked for is right or wrong, and whether that needs to be changed according to patient's need. Picker in 2005 talked about 8 principles of patient-centered care in radiology. So what it talks about is respect the patient's preferences, don't push anything on it. 2, coordinate and integrate the care that the patient needs. 3, inform and educate the patient what he is going to undergo and how it is going to be beneficial to him. 4, physical comfort. Make sure, especially patients who are in pain, patients who have cancer, patients who have fracture, you require to provide them absolute physical comfort. More importantly, you need to support them emotionally, because you don't know what they are undergoing in their mind. मेरे को कैंसर है कि नहीं, मेरे को फ्रैक्चर है कि नहीं, मेरा फ्रैक्चर हील हुआ कि नहीं. I'm going to show you a video of that, and that will talk about what emotional support means. Involvement of family and friends is equally important, especially in Indian situation, where one patient will be accompanied by 4 people, and all of them want to know what is right for the patient. Continuity and transition from the time patient takes appointment to patient getting out and coming back several times. And then access to care should be absolutely easy for the patient when he walks into your facility. So that is international way of looking at patient centricity. What is the Indian scenario? We know there are centers, radiology centers coming across the country. There is severe shortage of radiologists across India, not only across India, across the world, across Africa, across America, across Europe. You may be surprised to know that there are 2,500 radiology seats which come up for grab every year in India. After those 2,500 people pass, only 800 remain here. The rest of them go abroad. That's the kind of shortage we're talking about. With that, teleradiology is getting popular. It has several advantages, but disadvantages are they are run by radiology managers and radiology technologists. Hence, especially the centers which are not manned by radiologists, responsibility that I talked about of radiologists goes on to the technology, because he knows the next best what is right for the patient. WHO talks about virtually no radiologists in sub-Saharan Africa. It talks about teleradiology as the solution. But like AI, which separate out and commoditize radiology, teleradiology is doing that already, so we have to be aware of that. In centers which are manned by radiologists and technologists, we know we are the 2 key persons dealing with patients in any radiology practice, whether it is hospital-based or whether it is center-based. Of the 2, technologist probably spends much more time and faces patients' interaction more than the radiologist. So you, together with us, need to know how to handle these situations very well and more effectively. Our technologists should also understand the perspective of patient care beyond just technicalities of image acquisition. When you are taught, when I was taught medicine, I was just taught medicine. I was not taught about how to handle patients, how to handle medical legal activities, etc. Technologists are also taught how to scan. They are not taught how to interact with patients, how to be effective, how to be nice, how to be very, very nice. So we know what is our job. Our job is to safely use the equipment and technology without harming the patient or yourself. Position the patient properly to achieve to get good image, and communicate with the patients before, during, and after the procedure. But it's not as easy as it sounds. We have to provide absolute safety and high quality testing to the patient, and that's very, very challenging. It's not easy, especially in a hospital setting where more than 70% patients are absolutely sick. Half of them are unconscious, half of them are not mobile. So you need to do checkpointing very well. Many times the prescription can be erroneous. We need to check that again so that no wrong scan happens. you need to assist radiologists not only diagnostic but intervention procedures. And for that, you need to know what the patient is going to undergo and how job of radiologist will get easier. It's like a nurse in the OT helping out the surgeon in doing the job accurately and very, very fast. While the radiologist is doing something, it's important to interact with patients and families because they will be very, very scared as to why it is taking so much time to interpret. So his job is to make them calm, cool, and make them wait for the radiologist. As we get old in the system, this is what we do. We don't want to get up from our console chair. You rely on the ward boy or ward lady and say, Mama, ये patient को अंदर डाल दो. Patient का नाम नहीं लेंगे. बिल्कुल हिलो नहीं करके you'll shout from the console, not go inside and tell the patient how to hold breath or how not to move, when to swallow, when not to swallow. स्कैन होने के बाद मामा ये पेशेंट को बाहर निकाल दो और वो अगला वाला कौन सा लेने का है, नी वाला कि ब्रेन वाला. Always talk with patient's name. That will, one, stop a disaster that can happen. Two, patients feel at home. Taking a first name or full name is very, very critical. These are bad words in radiology. So it's a real time for us to change, all of us to change, not only technologists but also to radiologists. Because patients' expectations over last decade have completely changed. They think they're consumers, they think they are paying for it, so they better get good service. So we must accustom ourselves to that kind of environment. Communicating with referring physicians is what we were taught. Report लिख के दो, not even call. A provisional report लिख के दो, वो doctor पढ़ लेगा, don't talk to the patient. That has to completely change. What that will do is, it will eliminate the perception of radiology as commodity. Because there are thousands of CTs and MRs which have come across India, and with teleradiology coming in, it removes you and me from the point of service. If we do that ourselves, we'll be completely out and we'll be commoditized. So सस्ता है वो अच्छा है. Because we are providing ourselves as specialist provider. वो Amazon है, Swiggy है. It should not be like that. The third perception that happens about technology and radiology is anyone can do it. वो खाली photo लेना है, जरूरत क्या है? So that devalues our work efforts and it promotes price competition. So once you become patient-centric, those things will automatically change. We have to have patient-first kind of attitude. We have to minimize the delays. Some people take pride in making patients wait. So I've seen people, when they see 10 patients waiting outside, they get pleasure out of it. That's not the way we should be thinking of. Because almost all of them are in pain, all of them are disappointed. If at all they are waiting, we have to increase communication. You have to get out, talk to them, आपका पांचवा नंबर है, आपका छठा नंबर है, हम जल्दी कर रहे हैं, etc., etc. And you do that, half the problems get over. Call your waiting area as a lounge. You should not call waiting area as waiting area because that gives perception that you बैठना ही है 3 घंटा. What does patient expect from us? That also we must understand. They expect easy appointment access. They expect information to the content of the study, what is going to happen to them. You have to have some face time given to them. You and me both. Quick feedback. देख लिया, सर ऐसे लग रहा है, बाद में अच्छी तरह से देखेंगे, but this is what it is. Rapid triaging is very important. What is, everybody will come saying, मेरे पहले करो, मेरे पहले करो, मेरे पहले करो. But reassuring and rapid triaging is very, very important, and you can do that better than a radiologist because you've seen all the scans while scanning. Cost flexibility and transparent pricing is what they look at, which is beyond your control, it is in the control of radiologists. Other thing that we must understand is what is patient's perception and what is our perception about what we do. We think scan हो गया, dictate किया, transcribe किया, साइन किया कि मेरा काम हो गया. So this is a very small thing of the entire maze, because somebody is calling for scheduling, somebody is scheduling the exam, so there can be delays at every point for which you are going to be blamed. Then all of a reception se late ho gaya, nurse ne late bheja, billing late hua, they are going to talk about the whole time from the doctor told them कि इसका MRI करो, इसका CT करो, इसका X-ray करो, and when they got the result. Your result may be ready in 5 minutes, but if it is not typed and has not gone to the ward or to the doctor or to the patient, he thinks that is the time you have taken. So inform the patient when they should expect their exam results as a final report. Most important thing is being visible, and I am reiterating that several times. You have to meet and greet, discuss the results, make your radiologist boss make a physician connection with your own patient. They should feel he is also a doctor, he is not a photographer. Giving radiologist a face and a value as a part of healthcare system is very, very important today. What are the other dimensions of patient-centered radiology? Effective communication, physical comfort, educating the patient as to what is radiation, what is contrast, what is claustrophobia, what is safe, what is not so safe, what is completely contraindicated, etc. You have to alleviate the fear and anxiety that they have. And if we go to a new place, we are anxious. So, and we are in a welcoming situation. These guys are not in welcoming situation. They are coming there out of no choice. So first thing that you should do is get them out of their fear and anxiety. Coordination and integration of care is very, very important. Taking consent would make your radiologist boss completely safe, and it will avoid any medical legal issues. For all this, technologies play a very, very central role. Explaining the patient about the scan time, precautions that they have to take before coming in, after going into the scanner, etc. Talking to patients after every sequence, after every scan, after every contrast is very, very important. And there is an acronym called as ADIT. So you acknowledge the patient, say hello, hi, namaste, introduce yourself, who you are, explain to him duration of the scan time, educate them about what they are going to face, and at the end of the scan, say thank you to them. These are very, very simple things, but very few of us follow. Conveying poor diagnosis should be absolutely by the radiologist. वो bleed लग रहा है, वो metastasis लग रहा है बाहर आके corridor में बताने का is the most bad way of communicating with the patient. It has to be in absolute private environment. You have to avoid false reassurance. वो चल जाएगा, ठीक है. No, no means no. Involve patient's friends and relatives to cope with the diagnosis if it's a bad diagnosis. And you should not be doing it. Your boss should be doing it. But you should be handling those 3, 4, 5 minutes very, very effectively. A little bit about how we can do that. There are several websites available across the world. The best one that I have come across is radiologyinfo.org. It talks about every procedure in radiology that happens, and it explains them in a very methodical, simple way. So by showing that, you can prepare the patient for procedures. What they should expect is given completely well. You can do that as well if you can do that effectively. During the scan, during the procedure, etc. Explain the possibilities of contrast reactions, and it has to be handled very effectively. You have to give them some statistical example. कि 1 million में एक को death हो सकता है, 10 लाख में एक को reaction आ सकता है, etc. So don't scare them off, but you have to effectively communicate the risks also. Patient comfort is important. A lot of patients will be in pain, and then you are not going to have a good scan. So ask them if they require analgesic. Prepare them for pain tolerance. Paying attention to cleanliness is very, very important. You go to a hotel, you find a table dirty or dish dirty, you know you'll never go back there. You come into a radiology center and you find chadar dirty, changing room dirty or scan room dirty, sticky floor because of contrast that has leaked out is a complete no-no. Because patients, even they are uneducated, they recognize relationship between cleanliness and health. Everybody knows what is what. So this is a basic principle, and that is considered, dirtiness in a center is considered as a major failure. And it doesn't take too much time to keep things clean. Waiting room should be a place of comfort for the patient. It should not be waiting room as I said, it should be lounge-like situation. Inside the machine, make patient spend those 2 extra minutes rather than pushing the patient in. Explain to them, devices like this help, but not everybody will have them, but make them comfortable in any position that they are in. Ask couple of questions, ki theek ho kya, scan chalu kar sakte hain kya? That makes a lot of difference. Fear, anxiety is obviously going to be there, but you should never make patients feel neglected. And they feel neglected when you have not explained the procedure to them very well. You tell them something, something else happens, they are kami maaf nahi karne wale aap. Other thing that happens is patients always overestimate the pain. So if you anticipatively tell them, this is what you're going to feel, it makes everybody's job very, very easy. Give those extra 15, 20, 30 seconds, as I said. Expressing concern, showing empathy, accepting problem will aid in reducing anxiety, and that time is very, very golden. There are several ways and tips and tricks that are available on the website that I talked about. And if you tell these across these 5 or 6 verticals to the patient, which happens in 2 or 3 minutes, half your job is done. It is also important to have coordination and integration of care, because improper information and miscommunication is seen as a neglect by the patient. वो referring doctor ने एक बोला, readers ने दूसरा बोला, technician ने तीसरा बोला, patient will never come back to this. So I have to be extra vigilant on that front. Plain बोला कि contrast बोला, full penis बोला कि partial penis बोला, abdo-pelvis बोला कि chest abdo-pelvis बोला, full abdomen बोला कि upper abdomen बोला. That should never be conveyed in front of patient. This will also reduce unnecessary delays. So there are 6 fronts of coordination and integration of care. 1, being accessible. 2, align with patient's goal. 3, educate them. 4, respect them, wish them well, and communicate the result effectively. Consent taking is very, very important. Doctors forget them many times. You should never allow your doctor to do that, because everybody will get into trouble if something goes wrong. Harsh talked about this. I'm going to talk about how patient centricity is going to change with AI coming in. AI has been portrayed as potential threat to radiologists and technologists. AI obviously will not replace what I taught you in last 20 minutes. And if we can do that, we'll be better than AI anytime. These are certain resources that are available at your fingertip, which you can use to make your department patient-centric. What is the rest of the world doing using AI to become more patient-centric? One-stop registration and scheduling. Patient can do it yourself, like you book your Ola cab, like you book your Uber, like you book your movie on Book My Show, etc. This is already happening, and I'm sure it will happen soon in our country as well. Book it and walk in. Preparation will be, of course, told on the website. You should have an accessible web page for your center or hospital. You should have results which are available to patient on phone. A consult with radiologist also should be possible. मिले नहीं सामने तो फोन करके पूछ लिया सर क्या लगता है आपको. Patient should leave imaging center with results and greater radiologist, technologist and patient interaction. These are certain key maps we should be aware of, and it's a very, very long thing. We think it is very small. So patient goes to physician, he examines, he orders the test, then it is scheduled, then there is waiting time, then there is protocol selection, then there is examination or scan that is performed, then there is interpretation, then there is typing and finalization. Then the patient will go back to the physician and the physician will review the findings and then give the complete outcome of the disease that the patient is suffering from. So it's a long map. We think it is very, very small. For this to happen, we are the key part in the whole thing, and we should do our job well. This is one reference which came in your times in 2005. Somebody who was going to a doctor for 15 years stopped going to the doctor because she was not able to tell the patient that the scan is normal. This patient had CA breast. Somebody said on X-ray there is suspicious metastasis. So she went for CT scan. She was expecting a 15-second FaceTime with the radiologist saying there is no metastasis and you are doing fine. The doctor did not do that. Doctor did not communicate to physician. Physician did not communicate to the patient. And this whole thing took several weeks. And the patient decided that I will never go back to the physician. I will never go back to the imaging center. So that's the effect of not even saying that the scan is normal. Forget about abnormal scans. So we should be aware of this. And here is an exactly opposite example of a very, very popular center in New York and how they communicate with the patient. As soon as the scan is done, report is ready, they communicate that we have this center, your scan is reported by this doctor, your scan was done by this technician, this is what you have, we have already communicated to the doctor. This sounds like a big job, but if you automatize it, it is not so difficult. We may not reach that level, but we should try to reach that level. So to summarize what I talked about is given in this audio file. Can somebody help me in getting this on?
My name is Norm. In this video, we will be discussing the effective communication between radiographer and patients. Communication is essential between a radiographer and a patient for outstanding patient care. Follow me and let's dive into how to implement effective communication between patients and radiographers.
The 1.5-minute video talks about how we can take care of the patient. It's available on
Step
YouTube, so
1.
you need to.
Understand patient history.
This is all for technologists.
Before getting the patient into the room, the radiographer has to go through the patient's details that include the name, age, clinical history, and the examination
So
details
no
that
next patient
include
on the row.
the name,
और उसका need है
age,
कि fine
clinical
frame.
history, and the examination request. A radiographer must make sure that all the machines used in the procedure are functioning well before meeting the patient. Step 2. Meet the patient.
So you should go out and
After
talk to
knowing
the
the
patient.
vital details, the radiographer should greet the patient and address them appropriately by stating their name and introducing themselves as well as welcoming them to the examination room. Step 3. Verify identification.
Never forget this because it will be
It is
a
necessary to
disaster.
check and verify patient's identification. Before beginning the examination process, the radiographer will ask the patient about his or her medical history to appropriately document the management of the patient's well under their care.
This
It
happens
is
when
essential
you
to know whether the
take
patient
help
has
of
ever
water boy
had an X-ray
to
read.
do all this.
If the patient is a female, then the radiographer must ask about her MMP prior to performing
Don't
the
forget
radiological examination, so as to not irradiate the patient who may have missed her period or may be pregnant. Step 4. Prepare the patient. A staff member will first take the patient to the changing area and direct them to get dressed into their outfits and gowns. Jewelry including necklaces, watches, rings, and bracelets should be taken off before the X-ray procedure. Step 5. Start the examination process. As the patient enters the X-ray room, the radiographer will
Explain to
instruct
the
the
patient
patient to
what is
stand in front of
expected
the
out of the
X-ray
patient.
machine and position
Don't
them by
presume.
making sure that the hips and elbows are gently pressed. The radiographer will ask the patient to take a deep breath and hold it for a few seconds. For accurate results, the radiographer can demonstrate the proper way of breathing to the patient.
Most
Step
important.
6. Thanking the patient. After finishing the procedure, the radiographer should thank the patient for their cooperation. This is compatible with guiding them to the next step that they need to follow, such as directing the patient to the physician.
So when you think you are as a technician and you have machines and you have to perform scan, it's not even 10% of what is expected out of you. Because front office, hospital, IPOP, nurses, doctors, etc., patients and relatives, image quality, radiologists being happy about what we've done, advanced applications is all what you need to know. It's not only machines and performing the scan. And that's the real difference between an ordinary technician and an extraordinary technician. So in conclusion, patient centricity is the epitome of modern radiology, and that will find out AI. Efforts should be made to reduce patient discomfort. Patient-centric approach may increase the effort that you need to take, but the rewards are very, very strong because it increases patient safety and personal satisfaction. So in one sentence, you as technologists need to own the process and not be a small part of it. This is a very, very touching video that I am going to show to tell you what patients actually undergo, what they are thinking, what they are doing, and if we are not aware of it, we should be at least thinking that it could be this. See it very, very carefully. This patient has dementia. This patient has CFRS. In the hospital for 6 months. So we have to stand in somebody else's shoes and hear what they hear. Feel what they feel. We will definitely treat them differently. This was my last video and I thank you for your attention.
Thank you, sir, for an excellent talk. And with your lecture, to be concluded with the human touch or the personal touch, because we are doctor first as well as technician also. If we show the personal interest to the patient, we can definitely counter the AI also. Thank you, sir.
Thank you.
Any question from audience?
There cannot be any question because there is nothing scientific about it.
Okay, thank you. Thank you.
Any questions from audience in relation to Harsh Mahajan talk, sir? AI related, any question, please? Okay, thank you very much.
Now I shall request our chairpersons to felicitate our speakers for this session. I would request our speakers, Dr. Harsh Mahajan sir and Dr. Deepak Patkar sir, to kindly come to the dais. Please, sir.
कुछ अनाउंस करना है?
हाँ बोलो आप.
Request all three of us sir. Huge round of applause for sir, please. Now I would request all three of our chairpersons again to present the memento and certificate to Dr. Deepak Patkar, sir. Now I would request Prof. Dr. Rajesh Malik, sir, Professor at Department of Radio Diagnosis and Imaging, AIIMS Bhopal, and the organizing secretary for this conference, to please come to the dais to felicitate our chairpersons for this session. Dr. Rajesh Malik, sir, to Prof. Dr. Lovely Kaushal, to Dr. Chandra Prakash. Dr. Rajesh Malik, sir. Dr. Rajesh Malik, sir, to Dr. Lovely Kaushal. A huge round of applause for our chairpersons. And for our last chairperson, Dr. Rajesh Gupta by Dr. Rajesh Malik, sir. I would like to thank our chairpersons for chairing this session. Thank you, sir and ma'am. Everyone is now requested to proceed for lunch and kindly reassemble at sharp 2 p.m. for our next session. Thank you.
Thank you. आइए मैम। सब आ जाए।
Good afternoon all. Today I am speaking about a brief introduction about functional MRI. I am promising to in preoperative brain mapping. So, the definition for functional MRI is a procedure using MR technology that measures the brain activity by detecting the changes associated with blood flow. So, here in my presentation I would like to cover the topic in such a way to include about the property of blood in fMRI, physiology of gold, fMRI designs, and about the various paradigms used in functional MRI, and about the mapping technique. So we have different methods of functional mapping, like direct and invasive, as well as non-invasive imaging. So direct and invasive, as the name representative indicates electrical recording of individual neurons directly from the brain. But due to some reasons, it is limited to experimental studies only. And we have the non-invasive imaging. Non-invasive imaging, such as electrophysiological method and metabolic method. So electrophysiological method, two categories are there, like magnetoencephalography and electroencephalography, where we record the electrical signal directly from the skull. And in metabolic method includes the magnetic resonance spectroscopy, where we get information about various metabolites or chemical composition of brain. And single photon emission tomography and positron emission tomography, which we use radio traces for the cerebral, for detecting the cerebral blood flow of brain. And another fascinating non-invasive technology for detecting the functional mapping of brain is the functional MRI, or what is called blood oxygen level dependent gold fMRI. So what is the advantage of fMRI, or why an fMRI is being chosen? So the structural MRI only gives about the structural neuroanatomy. It will give the details about pathology or neuroanatomy. It won't give any delineation of the functional anatomy associated with the function of the brain. So in order to get the function or to detect the functional details, we may have to go for functional MRI. And how it helps surgeons. So it helps the neurosurgeons or surgeons by maximizing the disease tissue removal and minimizing the post-operative physical deficit. So the giving the patient a physical well-being and mental well-being is very important. So it helps the surgeons to maximize the disease tissue removal, thereby minimizing the post-operative deficit. And of course, there are limitations of other activation measurements like EEG because of low spatial resolution, then magnetoencephalography because of cost-related problems, then PET, low spatial resolution, as well as cost-related unavailability. Coming about the physiology of fMRI, the hemoglobin in the blood has a different magnetic properties depending on whether it is oxygenated or deoxygenated. When hemoglobin combines with oxygen, it forms an oxyhemoglobin, and it has got a specific nature in MR environment. And when it is devoid of oxygen, it is called deoxyhemoglobin. It has also got a separate behavior in MR environment. Oxyhemoglobin, which is a diamagnetic, may have no influence in magnetic field, which may not produce any artifact or any difficulties or any signal loss while doing an MRI. But in the case of paramagnetic substance or deoxyhemoglobin, which can alter the signal or which can deviate the signal in MRI. So these two, oxyhemoglobin and deoxyhemoglobin, have different magnetic properties in MR vicinity. So using certain sequences, we can elicit the human cortical functions without the administration of an external contrast medium. So oxyhemoglobin is actually diamagnetic, which don't produce or which don't have any effect in the magnetic field, whereas deoxyhemoglobin, which is paramagnetic, can alter the signal or can cause a signal loss in MR environment. So when our body is rest, or we people are simply sitting there, and when we are at rest, actually there will be a continuous supply, a normal supply of oxygen to the neural tissues. So these oxygen supply will be taken up by the tissues for the function, and there will be an increased concentration of deoxyhemoglobin in the vicinity of that particular blood vessel, which may cause a subtle artifact or subtle inhomogeneity in the area of interest. And if I am moving my right hand, or I am walking, or I am thinking, or I am talking from here, the area, the corresponding area responsible for the movement of right hand or responsible for the movement of for my movement demands more oxygen. So there will be a surplus supply of oxygen to the region of interest, which may lead to an increased concentration of oxygen in that area. Means oxyhemoglobin is more in that particular area. That means diamagnetic nature will be there. So when we are at a rest, there will be a paramagnetic nature in the neural area, and when we are at work, or job, or when we are activating something, even if we are thinking, we are learning, we are listening to something else, we are walking, when I am moving my right hand, when I am judging something, suppose something wrong I have seen, and if I am thinking whether it is true or false, so that way more our particular area of brain is being activated. So during that activation time, there will be a surplus amount of oxygen will move to that side, which means oxyhemoglobin